I look forward to a continued strong partnership between our legislature, Department of Mental Health, and community organizations like CQI in providing high-quality mental health care for all of our citizens. And again, thank you very much for the opportunity to be with you today.
Thank you, Jason. We look forward to hearing more from you and your work. You know, it's been mentioned several times that I won this award, but I need to say I'm really kind of the tip of the iceberg for a lot of people who have really pushed an agenda forward, both consumers and allies, many of whom are here. It wasn't me who came up with the idea for the consumer satisfaction team. Lori Ball and Deborah Delman, my wife, I think really together hatched that. And I have a great staff and have had a great staff from the beginning, really. And Melissa Goodman's not here today. She's at the Children's Mental Health Conference in Portland, and that's really an expertise she has. But I couldn't do this without her. She's been my director of operations for about 7 years, and I know things are going to get done, and I know that I can kind of get out there and try to talk about our findings and work on conferences like this. And going back to the mid-1990s, I joined Empower, and it was actually, I was going to say this later, on an informed consent campaign. So it's interesting how things have come around. We were fighting for informed consent. There was a pretty good policy, but at the time, it was clear that not all of the psychiatrists bought into the idea of informed consent. And in fact, we're really concerned that if they talked about side effects, that people might not take their medications. Makes sense, people might not take their medications. But I think, as Mary Ellen noted, it's not one or the other. It's a discussion. And that's the kind of thing that people have been talking about since then. And you know, there's a lot of people in the consumer movement and allies and family members we work with. It's really been, I think, through the last few years in Massachusetts, great to work with all stakeholders. I think people have been respectful, and even when there have been differences, you know, people have still talked and gotten along. So I would be unable to do what I do if there was more rancor. So I really appreciate everybody here and elsewhere who is helping the system forward. So I got this award, but I didn't get it automatically. There was a process that they went through. I'm still not sure what that process was. I haven't asked. I don't know what any. I don't know. I think I have an idea who wrote a letter for me. I haven't asked from records or anything to see what people said about me. I don't even ask my own medical records. I prefer not to see them. But so I met Valerie Bradley because she's on the National Advisory Committee for the Community Health Leaders Program of Robert Wood Johnson, and she was one of the people who made a site visit to meet with me and CQI and met with our board and lots of staff, so they were able to make me look good. So Valerie has been the president of Human Services Research Institute, also known as HSRI, which does some really great recovery-oriented research policy and evaluation work. And she's been the president since 1976, since its inception. And over that time, she's headed numerous nationwide projects aimed at assessing and improving the quality and delivery of services to people, particularly with developmental disabilities. So I thought I would invite Valerie here today to say a few words.